Coming up on Benidorm ER, a brain scan brings bad news.
I thought I was going to be strong. I'm not.
A poolside slip and a distraught dad. And banged up in Clinica Benidorm, one expat fights back.
I want to break free.
Around 1 million British tourists descend on Benidorm and its thousands of bars and restaurants every summer.
We got out here this morning, 18 of us, and obviously this is the first casualty.
It's Blackpool in the sun, isn't it?
Lots of them are after a good time, in the classic British fashion.
If you come back tomorrow night, we'll be here again. It might not be him, it might be one of us. This is Benidorm, mate.
It's that kind of town, where accidents can happen. Lots of the bumps and breaks end up at Clinica Benidorm. 3,000 British patients are treated here every year, some of them needing urgent medical attention. 18-year-old Jamie Blakeston from West Yorkshire is on his first trip to Benidorm with 8 rugby-playing mates. He's hurt his foot, taking a kick at a ball.
Must have kicked it wrong, I think I broke the bridge of my foot. Very painful.
Out with his mates in a bar, Jamie's played on a football game, but he missed the ball and kicked the metal bracket it was attached to instead.
Just my luck. Gut feeling, broke. But I really am hoping it's not.
Jamie's determined not to let any injury cramp his style.
I'm still going out tonight. Definitely. Even if I am hobbling about, still going.
But he is worried about his plans for a Benidorm booze-up.
I want to know if I can drink. If I can't drink, there'll be hell to pay because I've got about 10 shots to take.
That's because Jamie's mates have set him a drinking forfeit for having an accident. And there are other targets, tasks and challenges with drinks to be drunk if you fail them.
Come with a game, you've got to have a ball on you at all times unless you've got to take 10 shots. And if you spill a drink, you've got to get down on the floor, take your top off and do 9 press-ups.
So Jamie's hoping he'll be fit for action.
If I go in and he says it's not broken, I'll be happy.
He's lucky. The doctors have told him it's not broken, but it's very painful.
Little pain.
All right, keep going, keep going. Keep going.
Dealing with Jamie is A&E specialist Dr. Patrick Velter.
Jamie. OK, so look.
Patrick gives him clear and detailed instructions to protect the injury and ensure his recovery.
Yeah.
Use the crosshairs, don't put the weight on it, that's the most important.
Right.
And the treatment now with Enantium, it's an anti-inflammatory and painkiller, 1 tablet every 8 hours. The bad thing is, I know you're on vacation, but with the medication, no alcohol.
Right.
And also with the crosshairs, better no alcohol, because then the day after you're again here. Yeah. Okay? Well, enjoy your last days, the weather is fine.
Try my best.
Look, I will give it here.
Thank you.
Okay?
Yeah.
Bye-bye.
Bye-bye.
Perfect.
Despite his foot not being broken, Jamie is gutted.
Can you phone a taxi, please?
A brief cab ride may be the only chance he's going to get of sightseeing in Benidorm.
Go back to the hotel.
Number 9.
Right, thank you. What does that mean? Oh, God.
He's not happy. Hopefully he won't forget the doctor's advice. No alcohol and always use the crutches. It's not just Benidorm's young holidaymakers who like to live it large and make the most of all the sun and fun on offer. It's also very popular with the older tourists, and some of their accidents end up with a visit to Clínica Benidorm's emergency room as well. Mary Heinen from Broadstairs in Kent has just returned to her hotel from a sightseeing trip with a friend, where she's had a fall. She's hurt her leg. She's clearly in pain. It looks serious. An X-ray will show just how bad it is. Mary's supposed to get on a plane back to England tomorrow with her friend Anne. After their day out together, news of Mary's fall has come as a shock to Anne.
How'd you do it?
Been over.
You need to ring Mick. That's it.
Leave me to Mick.
Mick is Mary's son.
Give me Mick's number, I'm going to ring.
I will not.
Shut up.
If I want to ring Mick, I'll ring Mick.
Mick's nearby, golfing in Benidorm, but Mary doesn't want his holiday interrupted.
You ring Mick. You have to ring Mick.
The medical team get to work. Because of Mary's age, it's particularly important that they make sure she's stable. Mick or no Mick, Mary is booked in for at least tonight.
All I want to do is go home, and maybe tomorrow. Well, I hope so. I'm booked for tomorrow.
But that's up to the doctors and the insurance company. For now, Mary's sleeping off the day's exertions. Coming up, Jamie's been given the doctor's orders on drinking. But will he do what he's told? There's bad news for an impatient patient.
I don't want to stay overnight. I want to go home.
And one couple suffer the side effects of a long and happy marriage.
You're just looking at each other like idiots, aren't you?
Another day of glorious Spanish sunshine and fun at the beach for the thousands of British tourists who flock to Benidorm every summer. But for some, the day's taking a different turn. They're headed for the hospital. The emergency room's filling up. 78-year-old Marion Mitchell from North Shields suddenly collapsed in her hotel. Why is a mystery, so the doctors are running tests.
She seemed to be concerned that because you'd suddenly blacked out and then you suddenly got high blood pressure when you didn't have high blood pressure, that it needed to be checked. Yeah.
Daughter Pauline is also on holiday at a nearby resort. She's arrived in Benidorm to spend the day with her parents, to find her mum taken ill and dad struggling to cope.
He was very upset to see my mum like that, very upset.
Pauline had planned a surprise for her mum, but Marion's collapse has trumped that.
I came to shock me mum because I dyed my hair white and I got the biggest shock. So now I'm staying here till my mum gets put right.
Including a bad case of toe cramp that needs sorting.
It's in the cramp.
This one?
No. Yes.
Oh, that one?
No, that real. The big one, the big one.
Oh, God. Fancy getting a frozen toe.
Gone, gone.
Benidorm is a haven for retired pensioners. Many end up needing treatment at Clínica Benidorm, but once they've been discharged from hospital, they often need help.
Monkey, monkey.
That's where Ray and Claire Ruler come in.
We're having pie today.
The last 4 years, they've run a family business caring for elderly British expats. They employ up to 30 British nurses and offer personal care and support too.
Half an hour and it'll all be ready.
Half an hour, so I can take it with me in effect then.
They really, really prefer English food. They like the home comforts, especially when you're ill.
They're well established in Benidorm's British Quarter, with a very English home from home, and Claire knows that the way to keep a British pensioner happy is meat and 2 veg. 27-year-old Claire is a dab hand in the kitchen, but a meat pie isn't the only thing cooking.
See you later, Claire.
Claire's also got a bun in the oven.
I'm pregnant again. Very, very surprised. Come as quite a shock, as Lucas is only just 6 months old today. We weren't expecting to have one so quickly, but we are happy. We are excited about it. Right, off to feed the little man.
There's an antenatal appointment at Clinica Benidorm in the diary, but first there's more work to be done.
We do everything from dog walking right up to full-on palliative care. So we try and suit everyone's individual needs.
The dinner's being delivered to an elderly, hungry Brit.
Right. You all right, mate? I'll put your dinner up in the kitchen for you.
Another client, Peter, is in poor health and struggling, so Ray helps with the weekly shop.
The bacon, chicken and spinach tart, right? Yeah.
A selection of pies and other classic UK dishes.
There's 2 fish and chips, 1 gammon, 1 fish, 1 chicken, 1 bangers and mash.
A stash of English food, and Peter's perked up.
Happy days then.
It varies every day. Today's pizza and shopping.
Back at Clinica Benidorm, receptionist and British expat Maureen Santana is on good form.
Mondays are always busy. So are Tuesdays and Wednesdays and Thursdays and Fridays.
Maureen moved here with her Spanish husband almost 40 years ago. Her family is about to expand too.
I'm very excited. My daughter is expecting her first baby, which will be my first grandchild.
And Maureen has already got butterflies.
You're always nervous. Nervous for her, really, because you want everything to go well. You want her to be okay and the baby to be all right. So, nervous.
On the ward, Marion, who was brought into ER after collapsing, is settling in.
Right then, so I'll get back and grab a...
It's the day before her and Fred's 59th wedding anniversary.
So are you bringing the cards up tomorrow?
Pardon?
Are you bringing the cards up tomorrow?
Yeah, I'll bring them up, yeah.
Do you know where they are?
I'll find them. They've been a drawer.
Yes. The drawer beside the bed.
With nearly 60 years of marriage behind them, Marion and Fred have seen and heard it all.
When you've been married as long, you've got nothing to say to each other when you go out. It's the truth. Because once they retire, it's 24/7. So if you go to the pub, you're just looking at each other like idiots, aren't you?
You can be doing
wondering
that in the
what
house.
can say. I can do that in the house.
Yeah.
But here, because he loves a comedian.
And it's one anniversary tomorrow. So that's up the spoot. What am I going to do? I'll have to get one of them French mates in. You've got to have a laugh.
He's homeless.
Fred is struggling to cope with this crisis. He really appreciates the support of his close family.
And I was over the moon. I started to cry when I seen Pauline there. And I said, oh, that's a relief off my mind, like, you know. I wouldn't know what to do.
They've just been in again, and she just took me blood pressure. It's 170 something.
That's high now.
That's high.
So she went out.
Whilst Fred's out of the room, Pauline lets her mum know just how worried he's been.
He's frightened. He just said he's scared. He thinks this might be your last holiday. Right. This is your radar, my dear. Ready? Right.
See ya.
Marion and her family now face an anxious wait for the results of her test. All sorts of patients are treated at the clinic at Benidorm, and its 350 medical staff are used to the challenges. Some cases are serious, some need an operation, and if you ever need surgery, there's only one man for the job. Clinica Benidorm's top orthopaedic and trauma surgeon, Dr. Antonio Blasco Albel.
Hello, again.
Dr. Blasco is soon transformed from Hell's Angel to saintly surgeon.
It's very hot this now. We changed the black with by the white. I prefer the other, not this.
He's a busy man, seeing up to 30 patients a day.
Mondays and Thursday, more patients, maybe 24, 26, 27, it depends. Tuesdays in the afternoon is bad.
Dr. Blasco has itchy feet.
And this is the worst, the waiting.
He's keen to get cracking, as today he's operating on Mary's foot.
Sometimes in between one and another operation is 1 hour, is too much.
But surgery needs scheduling around anaesthetists and theatre timetables. As Dr. Blasco prepares for the op, Mary is left feeling anxious.
Well, I'm having a leg operation on my ankle that is broken, and they're going to put it right. Well, it's painful, and I'll be glad when it's all over. And I think they're going to come and get me in a minute.
This is the fracture. Now we put in good position and fix it with the screws both sides. But look, it's located and in place. Here is the antibiotic. We put antibiotic to prevent the infections. This is betadine antiseptic for all the skin. The fracture is normal.
The team get to work. The break is clean. Now they need to cut down to the bone to attach a metal plate to hold the bone in line. Using the real-time X-ray to help with positioning, Dr. Blasco prepares the plate ready to be screwed into place. For the experienced Dr. Blasco, it's as simple as putting up some shelves.
Now we close the wound and it's finished. Now there are no dislocation like before. It's everything in good place. Finish. With blood for everything, but finish. And sometimes the blood goes to the face.
With one op under his belt and the next not scheduled for a while, Dr. Blasco has just enough time to nip home for his lunch.
I go home to eat quickly, because 4 o'clock I start again in outpatients.
Out on the town, it's party time yet again in Benidorm's bars. Jamie from West Yorkshire suffered a foot injury after a mishap with a football machine.
That football machine in there? It's got a bracket underneath, and a kick bracket.
Clinica Benidorm's ER doctor, Patrick Velter, gave him medication and some strict instructions.
With the medication, no alcohol.
Right.
And also with the crowd better no alcohol, because then the day after you're again here. Yeah. Okay?
5 hours later, Jamie and his mates have hit the town. And it seems the bandage is gone.
No alcohol.
The drinking games are well underway.
No alcohol. No alcohol. No alcohol.
So he's ignored the no alcohol rule. And he's supposed to be walking on the crutches. Jamie's certainly an individual and no pushover. Oops, seems he is. Definitely not doctor's orders. Coming up on Benidorm ER. A common holiday hazard, but just how bad can a mosquito bite be?
Agony.
Happily married for 59 years, but bad news spoils the celebration.
I'm getting myself upset and I shouldn't.
And a first checkup for one of Clinica Benidorm's youngest patients.
You're about 7.5 weeks.
Thank
okay?
you.
First thing at the beach, and Benidorm's early risers are limbering up. Over at Clinica Benidorm, it looks like a busy morning ahead. Around 100 British holidaymakers and expats come through its doors every day.
Good morning.
In the hospital's emergency room, Fiona Jobling has a mosquito bite that needs a closer look.
How are you? Fine, yes, fine.
It's a common enough holiday hazard, but the bites become badly infected. Fiona's already tried 24 hours of antibiotics. Now, ER specialist Dr. Carmen Ruiz needs to check it.
The abscess is completely formed now, and we need to open.
Right.
You stay here?
How long for?
No, not longer. In the moment that in the surgery room they open the abscess,
Okay.
we are going to put an injection with the antibiotics through the vein. That is the more important, the antibiotics through the vein.
Okay.
Probably in a couple of days you are okay.
Right.
Okay?
Okay. God. It's the right mess, isn't it?
Getting the infected pus out isn't pleasant.
Be gentle. Ha.
Nice.
Okay.
Agony.
Ahora veremos lo que es.
Really agony. I know. Once get the stuff out, it's a lot better, but getting it out.
Now, when finish the test, you go to the room and put the antibiotic through the veins. In the morning, see you the chirurgy doctor.
It seems remarkable that a simple mosquito bite can turn so nasty. If the infection spreads, it could get serious, so the doctors have decided to keep Fiona in overnight. And she's not impressed.
I'm not. No, I ain't. No. I don't want to stay overnight. I want to go home. I've got things to do.
Doctors fear if the infection doesn't get better overnight, Fiona may end up needing an operation and are preparing for the worst.
So does all that have to go in before I get the operation? Yeah?
Fiona is sharing a room with Mary, who's recovering from the operation on her broken ankle.
Got to wait for these drips to feed through. And all being well after that, get the operation on my finger.
If there is an emergency, people generally call an ambulance, but getting to hospital is all that really matters. 2-year-old Paul Ayres, his father and grandma have just arrived in a taxi, and they're still wet from swimming in the pool where little Paul fell and banged his chin.
We were at the swimming pool in the hotel, and it was bleeding quite a lot first of all. They were really good though because they called the taxi straight away, so got it pretty quick.
Hello, Paul.
Paul's in safe hands with emergency specialist Dr. Iris Henkel.
Have you been bleeding?
Yes.
Paul, let me have a look. I'd like to have a look. Would you mind helping us? Let's show it to you. Oh, no. The grandma is taking...
Paul's so distressed that the only way to treat him is to wrap him tightly.
He's got to be a good boy now.
Now you're going to keep them down. Don't worry, don't worry.
No, I'm there. Don't worry, I got you.
No, that's fine.
It's distressing for Paul's grandma and dad, even though it's a minor procedure because Paul's so upset.
Okay, that's it.
It's very important, don't wet.
Okay,
Yes.
Wait, bye to the man then. Thank you.
Please wait outside for a few minutes because I'm going to write you a report.
Okay.
Okay? See you.
Maybe an inflated surgical glove will help.
He's all right now.
Ah, the wonders of a blue blown-up glove.
Thank you very much indeed.
You're welcome and have a good trip.
Thank you.
Got to quieten down now, haven't you? Bye-bye, wait, bye. Bye.
Marion, while on holiday celebrating her 59th wedding anniversary, fainted in her hotel. Doctors have run tests, and Marion has just been told some devastating news.
I went down for an ultrasound, and he said there's erratic heartbeat. And then a neurologist came, because I had a CT scan yesterday. There could have been a slight stroke. So that's what he's looking for. If it is a slight stroke, I won't be able to fly home. For at least 10 days. But I'll be okay once I get home. So that's my anniversary present today. Just want to see me parents. I miss them. I thought I was going to be strong. But I'm not. Not what I thought I was.
How far along do you think you are?
Across town, carers Ray and Claire are preparing for an important appointment at Clinica Benidorm. And a big decision needs to be made.
Sienna.
A name for the baby.
Keely. No, not keen on either of those. I like Arabella, but...
I don't like Arabella.
I like Arabella. Or Gabriella.
No way.
This one's not going to be easy.
And boys, I still like Sebastian.
Oliver.
Oliver.
One person with no problems when it comes to naming her grandchild is Clinica Benidorm's British receptionist, Maureen Santana.
The baby, once it's born, will be called Antonio, same as the father. It's like a custom here, but not many people keep that custom. Just that he was really looking forward to having the baby called Antonio. Clinica Benidorm, buenos días. Well, she's had one false alarm, so it's any day now. 184, the taxi number.
Thank you, Maureen.
Bye-bye, darling. She started getting contractions every 10 minutes. I think it can be any day, today, tomorrow, next day. Exciting.
Early afternoon, and rocking biker and top surgeon Dr. Blasco is wheeling his way back to Clinic at Benidorm to check his handiwork on Mary's new ankle screws. Thankfully, he's less jittery when he's performing surgery.
We go to see the patient. Hello, good morning.
Mary, who is sharing a room with infected finger victim Fiona, is hopeful the op's been a success.
How do you feel, Mary? Better?
Much better.
You must put like this.
Much better.
Can you move your toes?
Yes.
Perfect. You must do that.
Yes.
Also, lift the leg.
Lift the leg.
Bend a little. Stand again. Put straight and down again. This exercise.
Thank you very much.
All right. See you tomorrow. Tomorrow, see you again. This Sunday, but I come back. Okay? Bye-bye.
You have a day off on Sunday.
Thank you very much.
Thank you, Doctor.
Bye-bye.
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 I'm just waiting to go home. I'm going on my crutches this morning.
Dr. Blasco is happy that the operation has been a triumph.
Oh, look, very good. Normally, it's during 2 weeks must continue with plaster. 2 weeks after the operation, remove the staples of the skin. And normally 3-4 weeks after the operation, remove the plaster and start with the physiotherapy, but without support weight in the foot. And normally 5-6 weeks after the operation can start to walk a little, but total time to be recovered, and because of the age also, is 3 months, more or less.
Mary should be able to fly home tomorrow, but for insurance purposes, a nurse must fly in from the UK to accompany her on her journey. Down in reception, Claire and Ray have finally arrived for a scan on their unborn baby.
Tenemos una cita para un scan con Dr. Van Hermelen. Claire Louise.
They're tense and nervous about the appointment, but still arguing about names.
It's not like Sienna, it's not a real name.
It is.
It's not. All right, fair enough. Lara.
Ray is determined to have his way.
Lara, as in Lara Croft?
Yeah, it's not even... Do you know in the world called Lara?
Lara Croft.
Claire is clearly not impressed. This little human will have to remain nameless for a while longer.
Just one. No, there's definitely something there. You see it there?
Yes.
So it's very small still. But fortunately, no brothers and sisters there. Okay?
Just one.
Just one. So you'll be, well, we're talking about 30 millimeters. This is almost nothing, but you're about 7.5 weeks. Okay? Here you go. Here you go, Dad. There's the next one.
Ray and Claire now have around 7 months to finally decide on a name.
Right, in possession of a 7.5-week-old.
Nugget number 2.
Nugget number 2.
Marion Mitchell fainted while on holiday with her husband Fred.
The MRI scan when I had the hat on, that showed in the brain like epilepsy. So that was a bit of a bummer.
Tests showed she'd had a mini stroke and could be prone to epilepsy.
She had a fainting episode, a big fainting episode, and it's a total loss of consciousness. The worst scenario could be a big stroke, could be a big kind of epilepsy or something like that. I needed to check her brain and her blood, brain circulation and everything.
I'm fine. How you feel?
I feel great.
Absolutely great?
Yes, thank you.
Okay, you want to be free?
Yes, I want to be free.
You're going to be free. And you are protected with my treatment, so you won't have any problem during the flight. Very, very easy. 1 pill in the morning, 1 pill in the evening.
We have been very lucky because we are not in the worst scenario.
So there's definitely something wrong with my brain.
Oh, yeah.
Oh.
A little bit.
It's a little bit rusty.
Yeah.
Worn out.
Controlling the risk of a stroke and epileptic seizure will stabilise Marion.
Thank you very much. Bye-bye. Bye. Bye.
Despite the diagnosis, she's clearly feeling a lot better and a little flirtatious.
It's really nice. I think I might fancy him. Oh, dear.
Coming up, is Mary in danger of missing her flight home?
We need the nurse.
And Fiona plans to sing her way out of hospital.
I do a damn good Bohemian Rhapsody.
Benidorm's ER sees everything from major trauma to serious surgery to minor mishaps. Who would have thought a mosquito bite could produce this much pus?
Agony. Really agony.
It was a serious infection, so Fiona's been under the knife.
B.A. Finish. Finito.
2 days after her op and 10 days since she was bitten, and Fiona is hopeful of being discharged. Daughter Rebecca has arrived to take Mum home.
Oh, it better be my last one. Thank you.
Because Fiona's had enough.
I want to break free. God knows.
Seems Fiona has mercury rising.
I do a damn good Bohemian Rhapsody.
Or is she just going Radio Gaga?
Hello.
Hello.
How are you?
I'm good.
Yeah?
I'm very well.
Very well?
Yes.
Do you think you can go home today?
Yes, I do. Yes, please.
Yes.
But only if the infection's under control.
Very good, because she has a collection here. It's a large infection with inflammation, and now it is reduced, and it's not so large. And the patient is going to go at home today. Just now. Aprieta.
Thank you.
Bye. Bye.
Thank you
Bye.
very much. Bye. What's I trotter? Mary?
Yeah.
Finally, Fiona breaks free.
You have a safe flight home? Chin up.
And you,
2 more days
lovely.
to go.
Lovely.
Been lovely meeting you.
Yeah,
Shame it was under these circumstances, but...
Lovely to meet you too. You as well.
Fresh air, daylight, and freedom. That's lovely. Bye.
"78-year-old Marion Mitchell arrived at Clinica Benidorm after fainting in her hotel. After numerous tests and quite a few tears, the doctors diagnosed a mini stroke.
It's a shock. Will I be okay?
She's since been prescribed medication and is now feeling well enough to leave the hospital.
Everything's perfect then.
Maybe I go with you.
You come on with me. I'll look after you. You look after me, I'll look after you.
Yeah, okay, it's all right.
Thank you, darling. Thank you. Thank you very much. Come on, Frederick.
Marion can now at last begin to celebrate her 59th wedding anniversary.
Here's to good health, my dear.
Yes.
Be home tomorrow.
One person still hoping to leave today is Mary with her broken leg. She's waiting for the nurse sent from England by her insurance company to take her back on the plane. And to come to help, because she did ring him in the end, it's her son, Mick.
The nurse was told to be here by 1:30.
I'm worried because they've given her a time of 1:30, and she said she'd be here at 1 o'clock. But I mean, it's still 10 to 1.
But now they've decided that the ambulance men's got to go by 1.
You see, they've changed the time, and I've lost her telephone number. It's not her fault.
The ambulance driver, Juan, has arrived to take Mary. He hasn't been warned to expect a nurse and time is running out.
My report, they've got nothing saying I've got a nurse coming with us.
Right, okay.
Because the insurance hasn't told us
Yeah, there is definitely a nurse who arrived, yeah, definitely from England.
Yes, yeah, she arrived from England yesterday.
They've got to do it for the insurance side of it.
Right.
That's the way they've got to do it that way. They are travelling markers.
Right, well, I'll try to do it. Try to go on, tell downstairs to try to phone the company, see if they can get in contact with a nurse.
Yeah.
So, I mean, we do have to leave.
Right, okay.
I mean, you have to be in the airport by 2 o'clock.
Yeah.
And there's traffic on the road. And
it's 45 minutes from here, isn't it?
Okay.
Now they're trying to contact the nurse so she can get here quickly, so hopefully she'll be here, otherwise there'll be a problem.
1:30 is too late to leave, because we've got to be at 2 o'clock in the airport. So we're trying to get in contact with the nurse to tell her to come ready to come here and then we can leave.
But we are waiting for the nurse, Rosalind Leaks. She's not here. But we need the nurse. Not today.
And just when it's getting down to the last minute...
She might be here.
Oh, hello. Hi, I'm Rosemary. Oh, hello.
Lucky you were early, because we've got to go earlier. When do we have to go?
Now.
Not much time, Juan shows the nurse up to her patient.
They've changed the time.
I gathered. They're like, oh, we're going.
Yes, we're going right now.
They're off. A tense finish to Mary's benidorm break.
You have room for... Bye-bye. Oh, you could have some help. Nick, give him a hand.
They're just in time for the flight departure. Back inside, and receptionist Maureen Santana is celebrating.
I've been with my daughter who's just had a baby. Can't talk at the moment. Y no abre. My husband was rubbing her back and I was putting wet cloths on her head and her husband was timing the contractions with his mobile. I felt as if when I finished that day, I felt as if I had had the baby. She said to me, "Why didn't you tell me what it was like?" But you can't really tell the pain, can you? You can't say that. Clínica Benidorm, buenos días.
Maureen's colleagues are keen to share her good news.
Look. Thank you.
We'd like to see the baby.
Oh, wonderful baby.
And here is the other one.
Oh, but
Tony.
Yeah.
What's the weight, please, of the baby?
The weight, 2 kilos 700 grams. Very small. Perfect. He was only 1 day old, really. 24 hours.
Already in the paper and on TV.
Famous.
Next time on Benidorm ER, a patient desperate for an answer.
I'm just waiting for the results.
Doctor's orders for a patient requiring life-saving surgery.
He needs an operation quickly.
Just 1 second. Dime.
And the clinic staff who never stop.
It's a typical day, really.
Jodie Marsh gets to grips with her secret past while trying to help youngsters who are being bullied now. That's brand new tonight at 10. Next, though, it's time for the first of 2 live evictions in Celebrity Big Brother after the break.